Hey there, this is Dr. Briard wishing you a speedy recovery from your procedure. I want to take a few minutes to walk you through your post-op instructions so you know exactly what to expect after your surgery and how to take care of yourself at home. Remember, every single surgery is unique, so if you have specific questions about your surgery, feel free to reach out to us. First, let's talk about eating and drinking. You may begin eating as soon as surgery is over, but you should stick to a soft diet and avoid chewing on the surgical area. A good tip is that if you can cut it with a plastic fork, it's probably okay. Cut your food into small pieces and avoid anything sharp, hard, spicy, salty, or really hot. Don't use a straw and avoid creating suction for at least 1 full week, as this can cause complications like dry socket. This is not the time to start a diet or restrict your calories. Your body needs good nutrition and plenty of protein to heal, so protein shakes are a really great way to get this in. Next, let's talk about sutures, bone grafts, and membranes. Please don't pull on your lip or your cheek to look at that surgery area. Doing this can loosen your stitches and disturb your healing process. Some of those sutures are going to dissolve on their own within a couple of days. Others are going to be removed at your post-op appointment. If a bone graft was placed, you might notice tiny sand-like particles in your mouth. This is normal. Bleeding and swelling are common after surgery, especially in the first 1 to 3 days. Mild oozing is normal. If bleeding occurs, place a moist gauze or a regular tea bag, black tea, not herbal tea, over the area and apply firm pressure. Hold that pressure steadily. A good tip is to set a timer for about 20 minutes before releasing that pressure. If you check that gauze over and over again, it's not going to allow the clot to form. If bleeding does not improve after sustained pressure, you can contact our office. To reduce swelling, get an ice pack and apply for 20 minutes on, 20 minutes off during that first couple of days. Keep your head elevated and consider using extra pillows to sleep for the first couple of days. You might want to sleep with a towel over your pillow as well. For activity, plan to take it easy. Relax the rest of the day after surgery. Avoid bending, lifting, strenuous exercise for at least 48 hours. Giving your body time to rest is going to improve healing significantly. Discomfort is to be expected once the numbness wears off. We typically recommend taking ibuprofen and acetaminophen together on a regular schedule unless you've been told otherwise. I recommend 600 milligrams of ibuprofen and 1 extra strength Tylenol every 6 hours. It's important to stay ahead of the pain. Take that pain medication within an hour after your surgery. Don't wait for it to hurt. Even if it doesn't hurt, these medications have a powerful anti-inflammatories that are going to help your healing process. If you were prescribed a stronger pain med, be aware that nausea can occur. To reduce that risk, always take your pain meds with food and fluids. If you were prescribed an antibiotic, follow the instructions on the label. Finish all your antibiotics. If you experience symptoms like itching or swelling or any signs of allergic reaction, stop that medication and contact us or your pharmacy quickly. You might want to take your antibiotics with yogurt with probiotics to make sure it doesn't cause nausea. I think Activia is a really good brand for this. You may begin using that provided mouth rinse the day after surgery. Dip a cotton swab into the mouth rinse and gently apply to the surgical area. If you aren't comfortable swabbing that surgery area, or if you have trouble doing that, you can very gently swish warm salt water. I would personally advise against swishing that antibacterial rinse, as it can stain your teeth over time. You can also brush the teeth that weren't involved in the surgery. Please don't smoke during the healing period. Smoking significantly increases your risk of complications, and it's a major cause of bone graft and implant failure. I'm going to be making some specific additional videos with instructions for specific surgeries like implants, gum grafts, sinus lifts. If you had one of these, be sure to watch those videos as well. Remember, if you feel like something isn't right, don't hesitate to call the office and ask. For emergencies after hours, my cell phone number is on the post-op paper. Feel free to reach out to me. All right, wishing you all the best, and I will see you in a few weeks. Thanks.